Okay.
Hi, we are live now.
Hello, everyone.
I am Dr. Chow from rjclinic.
And I'm Dr. Carol.
Dr. Carol. Okay,
It's
don't
been
ask me
very
why
long
am I showing my
since.
face only because today is an invisible
What
man.
happened to you, Dr. Shaw?
Huh?
Your baju on lockdown, is it?
No, I decided today we're talking about eyebag. You have to focus on the face. Next time, if we focus on, if we talk about six packs, right? You will see without my face and only my body.
Okay, that's good.
Interesting, right?
Yeah, I thought you became transparent after the vaccine.
Which vaccine?
So many types of vaccine on market. Which vaccine you took?
I took Pfizer. I didn't have a choice lah. I didn't want to choose also. I think any vaccine is good lah for the community and the herd immunity. We want to go back to the previous life, we have to work fast lah. If not, we will lock down forever. I don't want bored.
Too many choices, and everyone is very confused right now, I think. But I see
Confused.
that Eyebag is getting more and more recognition. It seems like every time they say that nobody will take, but it seems to be like, when the registration open and then they just within hours, the slots are all taken up.
Selling like hotcakes, right?
Yeah, selling hotcakes.
No.
So Eyebag is one of the surprises during the MCO lockdown. Were you surprised when the government decided to lock down further?
Actually, I don't think they have any choice lah. I'm a bit surprised. I thought because our prime minister said that we won't have any lockdown anymore. Remember in January or February, but it's a
Oh,
surprise
yeah,
to me.
yeah.
It's a surprise to me that they decided to lock down. But I don't think they have any choice. When the case shot up to 9,000, near to 10,000, I don't think they have a choice. They are forced to, right?
I think ICU is overloaded, so that's why they need to plan accordingly, lockdowns.
Okay. Yeah, lor. So what do you do at home? Lockdown.
Lockdown, everyday cook. What to do at home?
Okay, so for those who join us, please help us share. We will wait for another 2-3 minutes for people to join in. Then we will start our today's topic. We will be talking about eyebags. I think very commonly, a lot of people have eyebag. Not only the elderly. I mean, some people are genetically born with some eyebags, and also a lot of people are confused on actually what is eyebag, what is teardrop, what is yeah. So I look weird talking like that and just floating around.
You just look like a robot face like that, in between two eyes.
So move here a bit. Okay.
At least my backdrop is very, very artistic, done by one of our doctors as well, Dr. Rainey. See, so artistic.
Yeah. So help us share. If you know someone who has eyebag or going to have eyebag or the eye circle, anything like that, you have to share this link to them so that they can come in and ask us any questions they have in mind. Then we can answer them. All right. Help us share. Yeah. Okay. So what do you cook? What is the best dish you know how to cook?
And that one you have to ask my husband, but I think it's sweet sour.
We are married.
Halal.
Oh my gosh. Disappointment to many people.
Oh, yes. Was it disappointment?
To the audience, not to me, to many audience, ma.
Oh, is it? Were they asking asking about my status? I don't think so. They were more concerned about Eyebags rather than my status.
Oh, okay. So what your husband like to eat?
That one is a very good question. I think you have to ask him tonight what he wants to eat.
You can see his face, ma. See his face.
I know you have a robot cook at home.
Robot? No lah. You mean the Thermomix People say it's robot. No lah. I tell you, it's not a robot lah. It's a good
robot,
tool.
right?
It's a good tool, and people say the Thermomix no need to wash. I tell you, it's the most hassle to wash because of the blade. Don't ever believe them, man.
I see a lot of people are using Thermomix right now.
Yeah, it's a MLM product, man. Of course, you will see a lot of this kind of advertisement. No, I mean, to me as a user, I tell you, it is a good tool, lah. It's a good tool, lah.
Convenient lah.
It's a very accurate tool, lah. For example, you want to cook kaya, or you want to cook something long or stew, very precise, lah.
But it'll be good to have one like if you are working full time. Now a lot of people FMCO stuck at home with kids. I think they need this kind of robot machines to help them.
Robot car? No lah, you have to stand in front of a robot.
At least no need to stir, right? Supposedly.
If you want to cook rendang every day for your kids, then can lah. Rendang, stew beef, stew pork, stew chicken lah. Okay lah, very good lah. Or you want to become a chef like sous vide beef, 75 degrees, 68.8 degree, whatever. Then good lah.
Oh, can lah.
Can.
Also.
No, you sous vide. That means you can set a temperature for, let's say, 1 hour, 2 hour at that set temperature 65 degree or.
Or then after that you take out and then you have to fry the steak.
Yes, you just put 1 2 second each side.
Oh, okay.
So inside is medium well, perfect one. So your husband think, wow, my wife become super chef, eh?
Wow, tapao from where? Which steakhouse you tapao from?
Yeah lah. So, and I think lockdown make a lot of chefs nowadays, right?
I think lockdown makes you upgrade your cooking skill, cause
bigger size chef because you cook and you eat, man.
Yes, provided that you exercise as well lah. Nowadays, can still have outside what?
Bigger size chef. So yeah lor. I think it's about time already. We go into our topic lah. What do you think?
Yeah, sure. Let's go ahead. We shall start our
alright
sharing session on laser eyebag removal.
Okay. Is it dark eye circle, eyebag, or something else? So we have two pictures here. So both have swelling right under the eye. Both have a swelling under the eye, but both are two very different things. One sounds like Korean kimchi, something like don't know what.
Korean kimchi, Accusculpt.
What is that? Is it a combination of?
Accusculpt is a very famous trend in Korea where they put filler under the eye to make the eye have this pre-tassel roll. And it makes you more useful.
Okay. All right. So.
Okay, we're gonna show a video, right?
But both look the same to me though. I mean, not to me lah. I mean, to a lot of audience, it will look the same, right? I mean, the swelling maybe
yes.
just 2 mm away from each other. But
one look like puffiness just under eye. Then another one look more. You can see that the color is also a bit more discolored, a bit more dark.
Other comment. Instagram. Okay, so one is trendy, one is non-trendy. Which one is trendy? How to pronounce it?
Is trendy.
How to pronounce this thing?
Accusculpt. Now I have to teach Korean. Accusculpt.
Oh. So
Accusculpt is basically something that they find it cute. You know, you can see it a lot in the K-dramas especially, where they have most of their actresses, right? They do have this under eye mild puffiness, which actually makes them look younger and cuter, because this is the appearance of a younger looking eye as compared to the left side, which is actually more tired looking.
See your eye? You have a?
Naturally no.
No, you don't have this Korean kimchi.
No. Korean kimchi is to be cooked.
I have Korean kimchi, you see.
I think when we smile, we naturally have.
Yeah.
This is something natural in Oriental women. Studies have shown that Asian women tend to have bigger pre-tassel roll.
Correct. So actually, both are different. One, the pre-tassel roll is actually a muscle. It's a muscle, and then eye bag is actually a bulge of fat under the eye. It's two different things. So we'll go deep into it. Then we will explain to you furthermore. So what you can see in this video, can see here, right? It has also some darkening, right? Huh?
Yeah,
Of
there's
the
some
curve.
discoloration caused by thinning of the skin, and underneath the
Mm.
capillaries are actually shown more, appears darker because of the darker veins running underneath the skin.
Correct. And also there's a sunken area here. So that's what they
Yes,
call
that
tear
one
trough.
later on there will be nicer photos that you can actually see the
Okay, let's
sunken
go there.
areas.
Yeah, dude. I get more attractive with age.
Yeah. Now listen.
So we have a video here to show you what is the cause of eyebag. Then you just it's a short video, so you enjoy, everybody.
Why do we get eye bags?
It is a sign indicating that we need to take a long holiday.
No. One of the main reasons for eye bags is aging. As we age, various changes take place in our body.
Yeah, dude. I get more attractive with age.
Yeah. Now listen. Our skin contains collagen and elastin. They keep our skin firm and elastic. In addition to this, we have fat tissue surrounding our eyes for cushioning. But as we age, our skin produces less collagen and elastin, causing our skin to become loose. Also, the muscles and ligaments that hold the fat tissue in place begin to get loose and the fat starts drooping down. This loose skin and fat make the area around our eyes appear swollen, giving us eye bags. Besides this, heredity, salt intake, smoking, etc. may also contribute to the formation of eye bags.
Oh.
Oh, okay. So what is the summary of this video? Okay, let's see next slide so we can see next one. Okay. Dr. Carol, you want to tell tell the
So you can
audience?
see where the arrows are pointing. If you can see where the arrows are, the first arrow actually points towards the muscle. That is the muscle where we're talking about. We call the accusculpt. So that is the cute part of the eye where you actually naturally have this muscle in the eye. Below that, you can see another bulge. That is the fat that is coming out from coming more obvious from the skin due to protrusion. Most of the time due to lax ligaments that are holding it. So when we are younger, the ligament is stronger. It holds the skin tight and the fat inside. But when we age, the ligament become loose and then the fat pouches out. So you can see two pouches like this. So when you can look at your own eye, when you have two pouches like this, the top one is most of the time your own muscle, which if you don't like it, we can put a little bit of Botox to shrink it. But the lower part is the eye bag. So that eye bag gives you an impression that you can see the lowest line, the darkest part, look like dark eye circle. This is what normal people used to say, this is dark eye circle, right? So this dark eye circle is actually what we call tear trough. A trough means something sunken. So the sunken is due to the attachment of the ligament to the bone part, so it's naturally a bit sunken. But because of the eye bag more obvious, right? So it becomes deeper. So it gives you an appearance of a darker shadowing underneath your eye. So this is why eye bag is a diagnosis of whether this is an eye bag, a muscle, or just a dark eye circle helps with it's important to get you the correct treatment.
A lot of times people will have either one of these or combination of these or of different severity, and then they don't know how to treat them. They thought of some pills or some cream will treat all of them. So, but in fact, as we know, different indication like you mentioned just now, this one the pretarsal that needs the botulinum toxin. Whereas the eye bag and the tear trough needs different other treatments, you see. So unfortunately, they all look about the same, but they requires different treatment. That's why you need the doctor to come up with correct diagnosis for you to give correct
Yes.
treatment, right? So today we will focus a bit more on the eye bag. right? Because we will be talking about a super laser or not super, a new laser that can burn the eye bag as well as tightening the skin around this area, that previously they required some surgery. So let's move to next slide. Okay, these are the common causes of eye bags. Number one is the loss of fatty tissue at the upper cheek, right below the eye bag here. So this area, right?
Yes, this area also.
Okay. Why does what's it got to do with the cheek fat?
Because the cheek fat is the one that migrates downward and leaves hollowness here. So it gives you even deeper tear trough sunkenness.
Okay, so you mean with the fat underneath here depleted, this ligament gets no support. Without support, it sinks a bit more, right?
Yes,
Sinks
sinks
more,
more.
and of course the eye bag here protrudes even more.
Yes,
Right.
definitely. So you can see two bulge. So the first bulge is the muscle, second bulge is the eye bag, then the sunken part, which is your ligament, the tear trough.
Okay, number two is weakening of orbital septum. Wow, Dr. Carol, what is orbital septum? This one very high five word,
Technically, it's more for somebody that has done a lot of research, especially nowadays our patients are very knowledgeable, they Google everything before they come. So orbital septum is basically something that holds the fat under the eye. Your eye bag fat is held by this orbital septum. So when it's loose, it's weak, that's when your eye bag appears. And genetically, some people get it at 20 something, some people get it at 50. So we cannot tell who ages faster. But the moment you see an eye bag appearance, you know that your own orbital septum is actually weakening.
Okay, so orbital septum, I think, is like a thin sheet a thin sheet of tissue here. So you can imagine under the skin there is this orbital septum here, a thin layer of sheet that protects your eye bag. In between the skin, the muscle, and the eye bag, there's the orbital septum. So with age, it weakens, right? It weakens.
Yep,
So
correct.
it protrudes out. Imagine just now we talked about sinking down. Now the septum is like this, weakening, protrude out. Understand? Anybody don't understand?
Anybody that don't understand, just have a look at Dr. Chok's the left eye, the biggest over Dr. Chok's
This one.
face. This face, yes.
Wow, this one teruk, this one.
This one very thorough, this one.
So today I have 4 eyes, 6 eyes, sorry.
6 eye.
Okay, how about this extra fat under the eye?
People just genetically have that. You can see it when they are young, when they are 16, when they are 18, they do have this eye bag that is genetic. And then you have a look at your parents have them too. So extra fats is something that we cannot control. But if you do have them, there's also ways to remove it. So do not worry.
Actually, why do we need fat around the eye?
Of
What
course,
is the function of the eye bag?
Of course, genetically, when we were born, it was to protect our eyeballs and the nerves around the capillaries around the eyes. It's a very fragile place. Under eye skin has always been the most fragile part of your skin on the face. So it's more for protection, but as we age, ligaments get loose, and then that's when your eye bag become more obvious. So
It's like,
that fat is actually important to protect the structures underneath, but too much of it causes aesthetically something that is not beautiful to be seen.
because the eye is very soft. Have you all eat fish? The eyeball, right? Very, very soft, jelly like.
You're comparing the fish.
Eyeball. So if you imagine the eye is inside the socket, you need some cushioning like absorber like that, or carb absorber, right? So you cannot
Yes.
be putting the bone. You understand? So you need certain cushion to absorb the vibration or movement or anything like that As you say, protection protect the nerves, everything because it's a very soft jelly like organ So actually, eyebag has its purpose lah, but too much of it, you will become aesthetically not pleasing. No? Right?
Yep.
Okay, next slide.
And this
Okay.
is the genetically muscle part of the eye, which is bigger than usual. Of course, she still has a bit of eye bag, but if you just focus on the roll, that is actually the eye muscle that we are talking about. So this is not eye bag, this is eye muscle.
I think we have seen a number of patients that come. Actually, they complain this as eyebag, you know. So I think,
Yes.
yeah. So I think they have to be careful. This I think it's a combination. A lot of them are this pretarsal roll. Maybe this one has a bit of loose skin as well, and so the treatment may not be similar to eyebag. This one may need some botulinum toxin and some skin tightening treatment in this area, right?
Correct. So you can see genetically her left eye and right eye also, one side of the muscle is bigger than the other. So this is quite common in our faces. Usually one side is stronger than the other, just like our hand and our legs as well. So the next one, I'll show you a younger patient. So this younger patient, you can see when she's relaxed, she don't have this roll. But when she smiles, you can see this roll. So this is naturally the eye muscle. So this is not the eye bag.
So you mean in the Korean movie that we see, smile, don't smile, crying, crying, sleeping, also have the roll one is not is not normal. It's not sorry, not normal. It's not natural. It's man-made lah.
Technically, yes. A lot of them inject it so that your eye appears smiling and happier most of the time. Because studies have shown from Korea that they actually measure the size of this pretarsal roll, and as we age, this pretarsal roll actually become weaker and bigger. Like just now that photo of an older woman. This one is a thinner one. So they actually have a specific size, a ratio that they find it the most pleasing in the eyes. So that's why they will tend to inject the fillers along the lower eyelid just to give them a little bit of that smiling face, smiling eyes kind of appearance. So yeah, even when they smile, don't smile also you can see it.
Okay. So, right.
So you can see this photo of aging. Now, this one is a very good example of dark eye circle. So you can see the top photo, she don't really have a huge bulging eye bag, but what she have is more sunken tear trough. So that is the ligament that has no support and very sunken. Her mid cheek is also sunken. So after putting fillers and support along the orbital rim here, you can see that her eyes have improved a lot, her dark eye circle. So this is a perfect example of when we say, is this an eye bag? We can treat this with filler. This is not fully eye bag, it's a combination, but with just using filler, it can improve the appearance. So usually the first diagnosis must be correct, whether this is just a combination, a simple dark eye circle, or is something more, for us to proceed and give you the best result. So the top photo, you can see the A and the B, she looks very, very tired, but the C and D, she looks much better.
Okay, so just to summarize, this one is a tear trough sunkenness. We use some filler to treat them, right? And this is the before and this is the after.
Yeah.
Right, without doing eyebag surgery or anything, because she technically didn't have a lot of protruding eye bags, right?
Yes.
Yeah. Although she has a pretarsal roll after injection.
The pretarsal roll is specifically injected in her for her beauty purpose. She wanted that, so yeah.
Next. Okay, so today we'll be introducing you something that we have at rjclinic, which is minimally invasive. There is something called Accusculpt laser eyebag remover. So basically, Accusculpt laser is a laser machine that emits this wavelength called 1444 wavelength, nanometer wavelength. So this wavelength, when it meets the fat, right, the fat will melt and die off. Okay,
That's
so
wavelength for fat removal.
correct. So basically, this machine is used for body sculpting, body contouring, or you love handle, thigh, some arm. You want to sculpt the body because those areas that has fat, it can melt the fat. All right. So, but apart from melting the fat, it also uses the laser to tighten the skin from underneath. Because when we know this wavelength, when it hits the skin as well, it will tighten the skin, right? So it not only has this fat melting effect, it also has skin tightening effect. So it is not only good for body, because just now we mentioned about Eyebag, right? The
Yes.
collagen bag, it fits into the purpose, the causation factor of the Eyebag, which is fat and loosening of the collagen.
Collagen.
Correct. So it can effectively treat these two problems
At the same time, which
at the same
normally,
time.
like, using fillers and everything cannot do for you.
Correct. So, so in essence, this machine, Accusculpt laser machines, is a fiber optic machine. Basically, you need to have a small incision for us to enter the Eyebag area. And then when the laser probe enters the Eyebag, imagine this is the Eyebag, and then we emit the wavelength, 1444 wavelength, to shoot the Eyebag so that the
And
fat
the
cells.
fat cells underneath.
All right, and at the same time, when we shoot the skin, this area, the skin will be tightened.
So actually, the good thing about this laser is they recover faster in comparing to traditional Eyebag surgery, because using laser alone, your downtime is 7 days. But with Eyebag surgery, it can go up to months, the swelling, because it's something invasive, and then you have more scar. So something that we don't want. So this is a good way to remove the Eyebag without having a scar, a big scar, right? So this is cleared. This machine is cleared by the US FDA. So Accusculpt is safe, and it's in the market for many years. So the function of it not only removes the fat that we don't want, it at the same time it acts to stimulate the collagen and tightens your skin around the area of the eye, which we all know that eye creams cannot achieve.
I think you just whatever you said just answered a question by our audience, David. I think he asked about how many treatments is required. Oh, the one we didn't answer yet. He asked about any downtime. So you mentioned about 1 week, right? So I think that 1 week is the longest time. I think 70 to 80% of the patient will recover within 2-3 days. Because it's just a small incision. So, but basically, if there's some bruising, this coloration of the skin, the greenish, bluish kind of discoloration will last for about 4 to 5 days later on. So that is the longest time for downtime. So when you talk about how many sessions, basically Accusculpt laser is a one-time treatment. Basically, it's not like some RF machine or any machine that is aimed at needs 4 to 5 times. Kind of thing. So, but basically, this treatment is minimally invasive. We put a small hole and target the Eyebag very precisely and burn them off, and they drain by lymphatic drainage, right? So it's a one-time treatment. Okay, this whatever we mentioned just now is being reiterated here. We just go through very fast. Accusculpt laser probe is being inserted into the Eyebag fat pad. So once the fat cell is being laser targeted by the laser beam, the cell die off and later on being flushed away by lymphatic drainage. So the pain level is actually quite minimal, because before the procedure we perform a nerve block. So we don't feel the area for about 2-3 hours. And one treatment is enough to reduce the Eyebag bulge by about 50%. Okay. So what is the benefit over surgery or any other treatments? You want to tell them?
So the benefit, of course, first thing the scar is very, very minimal. It's just one needle mark each side of the eye. So the needle mark will go away, will close up by 1 to 2 days, and then after that, it will subsequently be very, very minimal. It's not like something you need to suture close back with stitch or anything. So it's very safe. No any anesthesia is needed. General anesthesia we're talking about. That means putting you under full sedation. So it's also possible that we perform it so precisely using the laser probe that we do not cause damage to any other surrounding tissues like your eyeballs, your nerves, because it's very precise laser. So there's less damage, definitely. So that's why the downtime is so much more less. The treatment time is very short. Each eye will take approximately about 15 minutes, 10 to 15 minutes each eye, most of the time maximum half an hour, and the recovery is very fast. So during the time of the treatment, at the same time, the lower layer of the skin, we call it the dermal layer, the skin will be stimulated with the laser probe, and it induces a collagen production. So it causes skin tightening effect around the eye. So this is something that no other treatment can give you that effect of the skin tightening around the eye. So immediately after the procedure, you don't see any marks on your face except for the 2 needle puncture marks, which is mildly red. So you don't have a huge long downtime, which a lot of our patients love. So they can actually go out and see people. Even when they wear the mask, the mask actually hides the incision, the needle point. So it's actually quite non-invasive. So if you look at the advantage, we compare a traditional eyebag surgery and an Accusculpt. So traditionally, you need at least 1 to 2 months for recovery. Most of the time, it's 1 month. So in short, you can compare 1 week to 1 month like that. Okay, but more or less, it's 2 to 3 days downtime. Most of our patients. Then it selectively targets and liquefies the fat that you don't want. So the eyebags area. And it's much safer and easier as well, less traumatic to our patients. So it provides a safer alternative to our patients where they are looking for something that is, they don't want something so invasive like surgery, but they want something that's effective as well to remove the eyebag fat.
Okay, David have another question. He's asking that will Accusculpt laser overburn the fat in eyebag, which may later cause sunkenness in that area. Okay, I think David, we will show you the laser, then I will explain to you about this. I will answer you in maybe in 2 or 3 minutes because I need a video to explain to you. Okay, then move on. Okay, this is the before after. So you can see these are the needle marks that we enter. So it is quite small, right? It's quite small and it's not like a big surgery that has scar and suture all the way. So it's quite very straightforward, small procedure that targets the eyebag and burn the eyebag in this area. So you can see, I think this lady has 2 problems. One is pretarsal, the igiosal, and as well as the eyebag.
Correct. So it gives her appearance of dark eye circle, but actually this part which is darker is caused by the shadowing from the eyebag.
Okay, so this is the picture immediately after the procedure. So just to show you that it's not as very severe bruising.
Yeah.
It's quite mild the downtime. It's not as serious as something like blue black, swollen. It's very mild. Okay, so I move on to the video so that I can explain to David. Okay, so you can see in this video, there is me in the video and the same patient that we see just now. So you can see before we do any procedure, this is after the nerve block is done. So we open a small needle hole so that we can allow the laser fiber optic to enter. So a small hole is being done at the orbit, at the side of the eye bag, so that we can enter the area. So later on, this is the laser probe to enter the eye bag area. Okay, so very gently, the other hand, you see my hand, can see where is the eye bag. So we enter into it to make sure the safety. And once we are there, you can see, okay, this is the laser when it's already on. You can see the laser beam is inside the eye bag. All right, so the procedure is performed in that way for about 5 to 10 minutes to burn away the eye bag. Okay, so you can see this will continue for about 5-10 minutes. All right, minimal bleeding, a few drops of blood. Okay, so after we have performed, okay, you see, whenever we do this procedure, David, is that we don't overdo it. We give, because it's a machine that can give you power. You can set the power for, let's say, imagine it's a gun or what. You can use how many bullets you want. So I will set one bullet. I will set maybe 5 bullets and see whether the fat is gone. Then I'll perform this test to apply some pressure to the eyeball and see whether the eye bag will bulge out anymore or not. So what our purpose is not to kill as many eye bags as possible. Our purpose is to make sure enough fat is being set away so that the appearance improve. Right? So whenever after we've done the procedure, halfway through or a few times, we will assess the infraorbital fat tag. Whether it is enough or not enough, then we can, in this case, my assessment, I still think there is some bulging, there's still minimal bulging, eye bag. So I re-enter and perform additional shots to target the eye bag to make it less visible. All right. So after the procedure is done, then we can leave the incision point and you heal by itself in 1 or 2 days time. All right. Did I answer your question, David?
So usually the sunkenness is when you overdo it, but we will assess along during the process so that you do not have that more sunkenness because
Why
totally
do we
no
get
fat.
eye bags? It is a sign.
Okay, so this is this one is another example of this treatment. So this is about 1 to 2 months later. 1 to 2 months later, that you can see the appearance of the eye bag has significantly reduced. We didn't overdo it or underdo it. It's just nicely done. And this is, of course, without filler. We remove the bulge of the eye bag and tighten the skin, and just with Accusculpt laser. All right. So yeah, I think
Some
that
patients do need some fillers after the procedure.
correct.
Yeah, depending on your need. So the doctor will assess you on the spot and see whether you do need some fillers after the procedure or not.
Mm-hmm. Okay, anything you want to add before we end the session?
Any more questions for us?
Let me check. Make sure there is no more questions. Tak ada kan? No more questions. So, okay, we will see you some other time to explain to you more interesting topics on medical aesthetics. See you then. Bye.
Okay, bye.